Thank you for taking your time to watch this presentation on your upcoming knee surgery. You have chosen to have your knee replacement at the Royal Orthopaedic Hospital. This presentation, along with the JointCare booklet given to you, will provide you with the information on how to prepare for your surgery, what to expect while you're in hospital, and prepare for your return home, making your journey as smooth as possible. There are a few things you may want to take into consideration in planning for your surgery. It is important to remove any rugs you may have off the floor. You may want to move other trip hazards and make clear access throughout your home. Consider stocking up your fridge and freezer. You may want to prepare meals before you come into hospital, so they are easy to heat up. Microwavable meals are also a good idea that require little preparation. You may have limited mobility and may not be able to get to the shops. Ask a relative, friend or neighbour if they can help you with some shopping after you come home, or consider internet shopping. You will not be able to drive for 6 weeks and need to consider how you may need to get to appointments in that time. If you have a pet, who is going to look after it? You may have other commitments other than those we have mentioned you might need to make arrangements for. Plan well in advance if you can. All being well, we aim to get you home as soon as possible. On average, this is 1 to 2 days. You will have already attended or be attending pre-operative assessment clinic. During your visit, you will be asked questions about your past medical history. You will have your height and weight measured, blood taken, and maybe other tests. You will also be given a bottle of antimicrobial wash and instructions on how to use it, and also be given information on fasting before your surgery. If you are past fit and have a date for surgery, you will receive a letter in the post detailing where to report on your day of admission and when to stop eating and drinking. How can we help? You will have been given a JointCare information booklet. Please read this as it contains lots of essential information. You will also be given a pre-operative self-assessment questionnaire. Please complete this and use it as a reference guide when one of our colleagues contact you at home. Following this call, an occupational therapist may prescribe some adaptive equipment to make it easier for you when you are at home. This will be delivered by your local council prior to your admission. Your surgery will last approximately 2 hours. You will move from the operating theatre into recovery. Once you have recovered from your anaesthetic, you will be moved to a ward. If you have a medical condition that requires closer monitoring, then you may have to go to the high dependency unit overnight. All of the wards adhere to single-sex accommodation. You will either be in a bay of 4 to 6 patients of the same sex or in your own side room. We encourage you to change into your own clothes as soon as possible, as this can aid the recovery process. You will also need an X-ray after your surgery. You will be taken to X-ray on your bed or in a chair. You will have pain after your operation. This is normal and to be expected. It is really important to try and control the pain as much as possible, as this will help with your mobility and aid your progress. If pain is not controlled, this can slow down your progress, as well as making you feel uncomfortable. Some of the painkillers that we will give you can make you constipated. You will be given another medication to help with your bowels. They can also have other side effects, such as nausea, vomiting, and dizziness. Let the nurse looking after you know if you experience any of these side effects. On the right is a pain scale. You will be asked what your pain score is by the nursing staff throughout the day. If your pain score goes higher than 4 out of 10, let the nursing staff know. Please tell us if you are in pain and we will try and help. There are no specific restrictions for your knee surgery. Depending on when you come out of theatre, you may be seen by a physiotherapist the same day and helped out of bed. If you are not seen the same evening, then a physiotherapist will see you the next morning and start you walking. It is important to continue doing the exercises as illustrated in the JointCare booklet or your exercise sheet to maintain joint movement and muscle strength. Continue these for 6 weeks and beyond to get the most out of your new joint. Once you have been up with the physiotherapy team and they feel you are safe to continue mobilising, you can mobilise with the nursing staff or independently if your physiotherapist is happy. You will be seen regularly by the therapy team to continue to progress your walking and encourage you with your exercises. However, it is important that you continue with your exercises throughout the day. When your walking is good enough, you will try walking upstairs. If you are safe walking with elbow crutches or sticks, walking upstairs and medically fit, you will be discharged home. We aim to get you home in 1 to 2 days. We will also encourage you to rest with your legs straight during the day for short periods and encourage you not to rest with a pillow under your knee. We may also use ice to help with pain and swelling. You can ask for more if you feel you need it. On the day of discharge, the discharge team will discuss with you the arrangements to have your clips taken out of your wound. They will explain to you the medication you have been given and how often to take it. You will be given a discharge letter and any other important information. You will also be given information on preventing deep vein thrombosis and shown how to administer blood thinning medication. You are now good to go home. We ask that you arrange your own transport, as hospital transport is only provided in certain circumstances. You are safe to travel home in a car. You may want to ask a relative or friend before you come into hospital if they are able to come and collect you when you are ready to go home. If you have a long way to go, you may want to break up the journey and stretch your legs. If you live within 25 miles of the hospital, you will be eligible for our ROCK service. The team consists of nurses, physiotherapists and technicians who will come to your home. They will check your wound, make sure you are happy with your exercises, and try and address any concerns you may have. You will remain under the care of your consultant until you are discharged from the ROCK service. You will be referred for ongoing physiotherapy after your discharge. If you have been referred to the Royal Orthopaedic Hospital, you will receive a telephone call and then be advised if you need to come into the hospital for treatment or whether to continue with your exercises at home. You can be referred to your local hospital if it is closer or more convenient. We will send them a referral and they will continue your physiotherapy. In summary, prepare your home, take up your rugs, move other trip hazards, consider stocking up your fridge or freezer, and arrange someone to help you with your shopping. If you have a pet, consider who is going to look after them while you're in hospital. Please make sure that you have completed your self-assessment questionnaire. This will help us identify any assistive equipment you may need and get it delivered to you before you come into hospital. Start some gentle exercises that are pictured in the JointCare booklet. This will get you familiarised with some of the exercises. Remember to follow the instructions given to you by Pre-op in using the antimicrobial wash. Lastly, we aim to get you home in 1 to 2 days. Thank you for taking your time to watch this presentation. We hope you have found the information helpful. If you have any further questions, please contact us on 0121 685 4122.